If I could call upon the Ontario Health Coalition, please, to join us. If you can please introduce yourselves and state your name for the record. And you have 8 minutes to present, followed by 6 minutes each from each of the recognized parties. Thank you very much.
Thank you. My name is Natalie Mehra. I'm the Executive Director of the Ontario Health Coalition, and this is Deborah Devora Goldberg, and she's our Campaign and Research Director. The process with which this legislation has been developed and is being rushed through the legislature in these hearings requires us to put on the formal record our protest and our formal complaint. Legislation that covers 18 million Ontarians, 1,800 health service providers, that profoundly changes the way that our local health care providers deliver services, that gives unprecedented powers to the Minister of Health and to a new super agency to order mergers, mega mergers, amalgamations, service reductions, transfers of service, closures of service, and closures of entire service providers should be subject to a robust public process. The health system is understood in Ontario to be a public system. It's understood to belong to the people of Ontario. Most of our communities have spent the last 100 years or more building their local health service providers and supporting them. They do not belong to the government. The government was elected as a steward for that system and has no mandate whatsoever to do this. It was never mentioned during the election. More than 1,500 people and organizations that have asked for standing before this committee will not be heard in these two-part days of public hearings in Toronto. I have to say that I looked at the former pieces of major healthcare restructuring legislation, and this process is unprecedented. In the Lynn legislation, there were 5 days of hearings. There was 1.5 months of notice for standing before the standing committee. Even in the Mike Harris era omnibus bill, Health Restructuring Commission, there was public notice. There were 15 days of hearings across Ontario, and both of those pieces of legislation were subject to amendments. So that said, I'll move on to, because we only have 8 minutes, which is also the shortest time ever, to what the legislation actually says. This legislation gives extraordinary powers to the Minister of Health and to the government's appointees in the super agency to order, direct, coerce through funding powers, and otherwise force the restructuring of the health system. What has been said publicly only really is that it will create a super agency and some healthcare teams. Teams are voluntary. What this legislation actually does, and the majority of the legislation, is give new unprecedented powers to the minister and extraordinary powers to both the minister, service providers, and the super agency to restructure our entire healthcare system, including 1,800 service providers, in the minister's own words, covering 15 million Ontarians. Section 20 gives unfettered powers to the minister to direct any health service provider to do anything. Section 20, 31, 32, 33, and 40 all give extraordinary powers to the minister and to the super agency to facilitate by negotiation, to make orders, to make directives, and to make a whole variety of different types of orders to force mergers, amalgamations, mega mergers, service transfers, service reductions, service closures, and closures of entire providers. A number of those provisions are extraordinary. In particular, Section 20 has never existed in any form in Ontario law before. In all of these sections, there is no protection against transfer of public nonprofit services to private for-profit providers. And in fact, Section 20 explicitly gives the minister the power to do that. And in the leaked documents from February, the government's hand was tipped a little bit, in which The leaked documents showed that the intention there was to order the contracting out of support services and procurement, but that could easily, and those were undefined and therefore unlimited, and that could easily include hospital diagnostics, support services, a whole range of support services, and so on. There is nothing in this legislation that protects against rural hospitals from being taken over, amalgamated, in fact that's the intention, and closed down. There's nothing that would protect against any local nonprofit or public service from being reduced unilaterally. In most of the legislation, there are no procedural protections. Even under the Harris Restructuring Commission, there was a publicly written plan. The commission traveled the province and did hearings. There was the right to access documents. There was the right to appeals. There was a timeline. There was public notice. There were clear decisions. None of those procedural protections or democratic protections exist in this legislation. We are the most deeply concerned about this legislation that we've been about any legislation in my 25 years at the leadership of the Ontario Health Coalition. This government has no mandate to force privatization, mega mergers, amalgamations, transfers, closures, or reductions of healthcare services. We must be clear that we see this legislation as damaging and dangerous. The Harris-era health restructuring was 300 hospitals, just over 300 hospitals, brought down to what is now 141 hospitals in 260 approximately hospital corporations. This is 1,800 health service providers that the minister intends to bring down to 30 to 50 conglomerates of various different sorts in healthcare. This is restructuring on the scale that this province has never seen. The Harris-era Hospital Restructuring Commission cost $3.9 billion to lay off staff, build a building over here, move the service over here, rehire staff over here, transfer services, close down local services, and so on. We fear that this bill will cost billions of dollars, taking money away from care, cause upheaval and instability to a workforce that has already been stretched for decades. It will cause the loss of local services, inability for the public to have any meaningful input. This bill takes away any last vestiges of local control over our health care, for-profit privatization, and profound risks to the quality and accessibility of our health care. What Ontario needed was an amelioration of healthcare services, not another grand experiment in healthcare restructuring. We're asking you to repeal this legislation. If not, we're asking you to fundamentally amend it to protect the public against privatization, loss of local services, closure of small, rural, and local hospitals, and to insert procedural protections to ensure that the public has the right to have a say over our healthcare system that we fund and that we rely on from birth to death. Thank you.
Thank you very much. We'll begin with the government side. Ms. Triantafilopoulos.
Good morning, and thank you very much for taking the time to present to us. Now, you've spoken about the lack of public consultation, and you may be aware that the minister, our parliamentary assistant, Robin Martin, and myself as parliamentary assistant for long-term care have spent the last several months doing extensive consultations with stakeholders, with people that are on the front line. And so I find it very surprising for you to say that you feel there's been a lack of public consultation in this respect. One of the comments I also noticed on your website was that you said that the previous legislation was, and I quote, not perfect. In fact, far from it. So why don't you highlight for us today what aspects of the previous legislation are flawed, and what would you feel we should do differently?
Thank you. We believe that lobby meetings and backdoor meetings and off-the-record meetings are not proper public consultation. Normally, a piece of legislation like this would be initially put out in a white paper. There would be questions and key provisions. There would be wide public consultation on that discussion paper. There would be proper notice for that before the legislation was even written. That would be the normal process. Then that input would go into the drafting of the legislation. Then that legislation would spend a few months going through the legislature. There would be proper public notice for hearings. The public would be allowed to hear. Hearings would be held in every geographic region of the province. This is parliamentary tradition, which is being broken in this process today. None of that has happened. We represent more than 500,000 Ontarians and 400 member organizations, and our members have not been consulted on this legislation. I've just traveled the province doing town hall meetings. Nobody in the town hall meetings has been consulted on this legislation, and as I say, more than 1,500 people have applied for standing before this committee who will not be heard because of the process that you've chosen. I think that is indefensible, frankly. On the previous legislation, frankly, the parts of the previous legislation that we had problems with have been brought forward into this legislation. They were extraordinary powers for the local health integration networks to restructure healthcare. However, those powers were much more limited than these powers, and they were subject to at least some process and some democracy. There were appeals, there were public board meetings. None of that exists in this legislation. It was faulty, however, in that the appeals were not meaningful. The provision that you have in this legislation, it's section 48, that Cabinet can expand the purview of the legislation, so it can expand it to even more providers without ever going back to the legislature, is profoundly undemocratic and really not justifiable. The section 35, which allows providers to integrate themselves without proper process, without appeals and so on, that also is not correct, but part of that was taken from the LINS legislation. But all of the public interest provisions, faulty as they were in the LINS legislation, have been stripped in this legislation. All the community engagement ones, the Democratic Board, and so on and so forth.
I think that you'll find that many, many stakeholders who in fact were consulted would be very disappointed to hear that you think that there wasn't in fact a very public, transparent consultation process. But let me ask you another question. You've obviously read Bill 74, and I'd like to ask you, how many times did you find the word privatization or privatizing healthcare actually appeared in this bill?
I couldn't name off the top of my head how many times privatization is in the bill, but I can say that there are more than five separate sections in the legislation that give extraordinary powers to the minister and to the super agency to order or coerce the transfer of public and nonprofit services to private and for-profit providers. And that there are no provisions that actually prohibit that from happening.
And I would suggest to you, having also read the bill very carefully, privatization, privatized healthcare comes up actually 0 times in this bill. 0 times, not once is it reflected in this legislation. So perhaps I would just suggest that you might want to take a second look at that.
If there is no problem, if there is no intent to privatize our healthcare services, then you should pass, respectfully through the chair, then the government should pass amendments under each of those 5 sections explicitly saying that you will not transfer any public and not-for-profit service to a private for-profit provider or any part of that service to a for-profit provider. And we have, as I say, asked for the bill to be repealed. We think it's so ill-conceived and badly written that it should be repealed and rethought. However, if you pass it, we ask you to make those amendments.
You have 1 minute.
So I heard you say that a lot of the powers that are in this legislation were in the previous legislation?
And there are extraordinary powers in this legislation that have never before appeared in Ontario legislation.
And you referred to Section 20, which is a section about directives from the minister.
The minister can issue a directive to any health service provider to do anything, unfettered.
But the other parts of the legislation about integration and all those things, that all has been done before, and it was in the predecessor legislation, which you to answer your question, to answer the member's question, parts of those sections were in previous legislation. This legislation is much, reaches further in terms of grabbing power, and certainly reaches further in terms of grabbing power with no accountability, no process, no public interest protections, and no principles to guide the restructuring.
Thank you very much. We'll move on to the official opposition. Madame Gélinas.
Thank you so much for being here, Mrs. Mehra. My first question is that you have 400 member organizations. Yeah. You have over 500,000 members. Not one of them, how sure are you that not one of them has been consulted?
I'm positive. We have had several emergency meetings with our members, our board of directors, our local coalitions, and none of them were consulted on this legislation. In fact, the first time we saw anything about it was when the documents were leaked in February.
Is this typical of new legislations that and organizations that have so broad membership throughout the province would not be consulted?
No, it is not typical.
It's out of the
I think it's unprecedented. I mean, as I say, I looked at the process and I remember the process from the last two major rounds of restructuring. And even though at the time they dropped the bar in terms of public consultation and public process, and in fact, they're the subject of books and university theses and so on about how poor the process is, this is worse than even those were.
Okay. So you talked a lot about the bill not specifying not-for-profit, and if it doesn't say not-for-profit, then it's not a big stretch to assume that it's because there's going to be for-profit delivery of our healthcare system. Why would people matter? They would still gain access with their health card. What difference does it make if it's a for-profit provider or a not-for-profit provider?
Well, this is the concern. The majority of long-term care is for-profit, and chain companies have taken over the majority of that. We know that the for-profits are lobbying to take over the chronic care hospital beds and the convalescent care beds and other services that they want to expand their market share. This committee is going to hear from a whole array of providers over the next two-part days of hearings, and those providers will talk about how they want more unfettered market access in order to expand their market share in a lot of cases. The for-profit home care companies that now control the majority of home care, the for-profit long-term care companies. But our public hospitals are still not-for-profit in this province. There are still a whole array of non-profit long-term care homes, home care services, community service providers, and so on. When you foresee what happens when the providers, in the minister's words, are unfettered to form their own conglomerates, who is going to come to the top of the heap? It's going to be the large hospital CEOs who see themselves as the top of that heap, and the chain companies that are poised, that are in the position to take over more services and to expand their market share using the tools in this legislation. Whether it's the current minister's intent or not, and who knows what that is, what is in the legislation are unheard of powers to order these things to happen, and almost no conflict of interest protections for the super agency or for anyone else. And then the conglomerates are left with no public governance to run themselves. I think the risk of privatization in this legislation is the highest that it's ever been. And when you have a government that is extremely close to the for-profit long-term care industry and other for-profit providers, when you have for-profit surgical clinics already bidding to take over our public hospital services, the risk just continues to go up. In terms of the problem, I take issue with the notion that the health minister has said that you will still use your OHIP card. The evidence from Ontario and across the country is that when for-profit clinics take over the surgical and diagnostic services from hospitals, they extra bill patients. We've called every private clinic in the country and the province 3 times over the last decade and caught the vast majority of them extra billing patients, hundreds or thousands of dollars for medically necessary healthcare services. And lest anyone believe that you could just regulate them, in British Columbia, the government has a regulation to stop them from charging user fees. The clinics have taken the government to court and sought and won an injunction against the government prohibiting them from enforcing their own protection for patients against extra billing and user fees in the private clinics. And a number of the private clinics are double billing as well. Similarly, in long-term care, the for-profit long-term care homes have led the opposition to improving minimum care standards. You know, the for-profits have lobbied intensively for deregulation and often won it, and currently are lobbying for deregulation of the inspections process. These things are not in the public interest. They raise costs for families who have to hire in extra care in long-term care in order to get enough care for their loved ones. They do mean that you have to pay for health care with your credit card as opposed to your OHIP card. And they do undermine single-tier public Medicare in this country.
You have 1 minute.
Sorry, that was long.
No, that was very informative. So Would you see that one of those Ontario Health teams would be led by a big existing, I'll say Extendicare, or name one, an existing private provider in Ontario could become the lead agency for one of those Ontario Health teams?
Yeah, I won't call them teams because a team is voluntary. These are conglomerates. They'll be made up of a mixture of mergers, transfers, takeovers, et cetera. And yes, absolutely, the for-profits will be the most organized. The chain companies are the most organized to take over a new array of services, and which is why they're very positive about this legislation. It gives them, access to whole new markets.
Thank you very much. Thank you for joining us today, presenting.
Thank you.